Hi, and welcome to Honest Mental Health Talks. Today, I want to talk about trauma. The hardest part about talking about trauma is the fact that there is so much to trauma that it's difficult to compact it down into a single talk, which means this is not going to be the only talk we have about it. Trauma has a number of sources, it has a number of responses, and there's a number of symptoms that come along with it and a number of effects that come from trauma. So we're going to try to touch a little bit on what trauma is today. And down the line, we're going to talk about the differences between the types of trauma, the difference between post-traumatic stress disorder and post-traumatic stress. We're going to talk about the different aspects and the different outcomes. And I'm even going to probably touch on some of the different modalities in treating it because this is something that I specialized in during my training. So first off, what is trauma? Trauma is a huge umbrella term for the body's and mind's response to any stressor that exceeds what it is capable or is designed to understand and to handle. And that is going to be different from person to person. What is traumatic to one person may not be traumatic to the next. If you have a phobia of spiders and the spider drops down on your shoulder, that's going to be traumatic. For me, as somebody who doesn't share that phobia, it's just going to be a little bit disconcerting at best or at worst. So it's going to be different from person to person. So when we talk trauma, don't think that I'm trying to just put it all together under one big, this is what it is, and that's all there is to it. That's far from the case. Trauma has existed since the dawn of man. As long as there has been stressors that exceed our capabilities, there's going to be trauma. In training, we talked about, you know, cavemen running from saber-toothed tigers. That must have been traumatic for them. For you and I, it'd be even worse since we're not even used to them being around anymore. So they experienced trauma. Now, how they handled it, we don't exactly know. We don't have written records going back that far. We do know how certain traumas were handled later in life, and we know that what we now consider PTSD and other effects coming from trauma have existed for as long as recorded history has. Herodotus, who lived in the 4th century BCE, talked about ancient Assyrian warriors, which meant that they were generations before him experiencing effects on the battlefield in which they saw the ghosts of previous soldiers attacking them while in a different battle. We now know that as intrusive memories, and our soldiers see things like that even today. But this is something that happened prior to the change of calendars, prior to the difference between AD and BCE. So this has always been there. It's just that we haven't paid enough attention to it to understand what it truly is. So even today, research and education on trauma is limited because we're still learning what it is and what to do about it. So if they could have experienced trauma back then, we can experience trauma today. And despite what some people tell you, being affected by trauma, being traumatized by something is not a sign of weakness. It isn't. A strong man can be just as traumatized as someone who's weak. It doesn't matter. It matters in how your brain processes the event. And that is going to be different from person to person, and it's going to be different from event to event. Something that might be traumatizing the first time it happens to you might not be the second time. And I'm not saying that there are events that will never be traumatizing. No, that's not the case. What I'm talking about is when you first learn to drive and you're driving down a city street and somebody cuts you off. Well, if you've never driven before and you're very new to all of this, that can be a traumatizing effect. Me, I've been driving 40 plus years. I'm driving down the street, somebody drives past me, cuts me off. I might not even get upset. I'm probably going to, but I'm not. So it's going to be different. And it's going to be something that you're going to have to learn to understand yourself and how to deal with what is traumatic to you and how you respond to trauma. With some people, the trauma is a single event, like I was saying, getting cut off by a car, the spider on the shoulder, something like that. That's a single event that causes trauma. The term for that is acute trauma because it comes from an acute situation, a single event. There is complex trauma, which is when a traumatic event is taking place in a traumatic environment under traumatic circumstances where there's so much going on that it becomes more in depth and there's more to deal with than an event. That is the most common type of trauma that we see in combat soldiers. They're under a traumatic situation. They're under combat, under fire. They're in a traumatic situation. They're in a foreign country, or they're in a country in which they've been invaded. They're in a traumatic situation. They see their best friend get shot. They shoot someone and see it. Something happens that is traumatic in a traumatic environment under traumatic circumstances, and it begins to balloon outward from there. Chronic trauma is more like what you have in an abusive relationship or when you're being abused as a child. It is something that may not happen in a specific incident, but it's a series of events over a period of time that is normally, interspersed with periods of calm, but it's constant. It's over and over and over and over again. And that in and of itself begins to wear down on you, whereas a single event may not be horribly traumatic. The lifestyle, what the existence and the situation that you're being forced to live in becomes traumatic in and of itself. Now, the sad thing is, all three of these may be present in the same person based on different events. You can have someone who is in an abusive relationship, in a horribly abusive situation, in a traumatic situation, and then an acute situation takes place to that person or at that person, with that person. All of it can take place at once, which means that trying to deal with that becomes a very complicated situation because what do you treat first? Where do you go first on that? And there's a number of schools of thought on how you're going to handle that. Do you go with the biggest trauma? Do you go with the newest trauma? Do you move back and go with the earliest trauma? Do you deal with the trauma based on the situation? All of that is going to have to be worked out between the person who's getting the therapy and the person who's administering the therapy, the therapist, the counselor, the psychiatrist. It's going to have to be something they're going to work on together. So this is going to be something that is going to take time. So when you're sitting here dealing with something, especially if you've come out of an abusive relationship or an abusive childhood or a long-term combat situation in which you were in combat multiple times, saw things multiple times, give yourself a break. Understand that this is not something that you're going to be able to sit there and say, oh, hey, thanks, one session, we talked about it, we're good, we're done, and walk away. If it were that easy, come on. We have generations upon generations of people who have been dealing with this and living with this and suffering through this without understanding, without being able to deal with what's going on inside their own head. We need to find ways to deal with each individual. We need to find out what it is that was traumatic to you, traumatic to your friend, your family member, your loved one that's dealing with all of this. We need to find the base, the underlying root of the trauma, and then we need to find what works best. When it comes to PTSD, which is currently the most talked about and viewed traumatic response in the way of a mental health crisis, there's a number of different ways of dealing with it. As of right now, mid-2020, the three ways that the VA, which is the one dealing with it the most consistently, have found to deal with PTSD are CBT, which is cognitive behavioral therapy, something I'm going to talk about a lot. I'm probably doing an entire talk just on CBT. There is persistent immersive therapy, which is something along the lines of writing about the incident over and over again, which can be somewhat traumatizing. So it's one of the ones we have to work on very carefully. And there's also EMDR, eye motion desensitization reprocessing, which causes you to go in and have to reprocess those memories. If done properly, it can be very life-changing. If done improperly, then it can be re-traumatizing. So it's something that people need to be trained in explicitly before we ask them to use that with somebody. So these are all the different variations of how we're going to work with it. And there are ways that you can even work with it on your own. But I would recommend highly that if you can, if you have the insurance, you have the money, and I hate basing it on that. Trust me, that is probably one of my biggest pet peeves in the mental health industry, is basing the treatment on money. But if you don't have that available, there are ways to deal with it. If you do have it available, seek out an actual trauma counselor, seek a grief counselor, seek out somebody who is trained in what it is they are dealing with and going to be helping you deal with. Because just going to somebody, general practitioner type or a general counselor type, a licensed marriage and family therapist who has no training in trauma, and nothing against them. Some of my good friends are LMFTs and they're very good at what they do. But I'm not going to ask them to step up and deal with somebody who's just come back from a combat situation in which they saw their best friend get shot to death. The same reason that I'm not going to want to step up and try to argue out an argument between a mother and child that's been going on for some time when I don't know what I'm doing. I'm not helping them by trying to sit here and pretend that every mental health issue is the same. They're not. So don't sit there and expect someone who isn't trained in trauma to be able to help you as much as someone who is. They might try, but look for somebody who's a specialist. And above all else, I've mentioned this before, I'll mention it again, when you're going to therapy, when you're finding a counselor, when you're dealing with any of this, make sure that things click between you and that counselor. If you can't feel comfortable enough to relax and listen to them and tell them the truth about how you feel and what is going on inside your head, you're not doing anybody any good except for maybe their pocketbook. So we're going to talk a little bit more about other aspects of trauma as time goes by. We're going to talk about complex, chronic, acute trauma. I'm going to talk about PTSD. I'm going to talk about PTS, post-traumatic stress, or PTSD, I guess is what they call it, PTG, post-traumatic growth. That's it. I'm going to talk about that, how some people can take a traumatic situation and turn it around and turn it into something that causes them to be a bigger and better person. I'm going to talk about how you can handle your stress on a daily basis that comes from your trauma, and what to look for in when you need that outside help. We're going to talk about all of this, and we're going to see what we can do that's going to help put you on the right path. And until then, have a great day, take care of yourself, and we'll talk again later.